Does the vaccine have the potential to harm an unborn child?
There's no evidence right now to suggest that the vaccine will harm a developing baby. So one, when I talk to my patients who are pregnant about the COVID-19 vaccine, I often ask, well, what do? Are you meeting face-to-face with people often? Are you out, in general, around a lot of people? Well, that increases your risk for being exposed to COVID-19. Two, what's happening in the community where you live? Are you in a place that has a lot of COVID-19? In Kalamazoo County, we're just coming out of our surge right now, and even if you compare us to other parts of the country, we're still at a very high rate of COVID-19. So we're at a higher risk as a community than other people. Then it's thinking about, do you have underlying medical condition that maybe make your COVID-19 disease even worse, such as lung disease, heart disease, diabetes, being overweight. All of these are risk factors that make COVID-19 disease sometimes worse. We do know in pregnant patients that COVID-19 can be more severe. I've taken care of pregnant patients in the hospital who have been on oxygen after being with COVID-19, and some pregnant women have gotten really sick. So we do know, as compared to other women and other folks, that pregnant women are at higher risk for those severe disease. All of these are reasons why a professional society, such as the American College of Obstetricians and Gynecologists, have recommended pregnant women to consider to be vaccinated, to protect them from developing severe disease, and weighing the benefit of the vaccine with the fact that in the clinical trials, so all the studies that were performed by COVID-19 didn't include evaluating about pregnant women in those studies. So we don't have strong evidence for the clinical trials about the effects on pregnant women. However, we have our experience in the practice of medicine about what we are concerned about with vaccines. In general, we avoid giving live vaccines in pregnancy. For example, like MMR or the chickenpox vaccines. We don't give those in pregnancy, given there's some theoretical risk to the babies as say live vaccines. But none of the COVID vaccines are live vaccines. They work in a different way. So that's why the professional societies and doctors, including myself, help guide our patients to consider what's your risk of COVID, acknowledge that there's increased risk from severe disease when you are pregnant, and acknowledge that scientists and doctors believe that this vaccine is indeed safe for pregnant women and in all stages of pregnancy. So it's recommended for pregnant women to consider the COVID-19 vaccine.